I got so much motherfucking design on right now.
Break it down, bring it back, make it clap. I got 3 old thoughts, new block, where that day. Bitches on my line, and you know.
Topical administration of medications over a localized area allows the absorption of drugs through the skin, mucous membranes, or tissue membranes. A topical medication may be formulated as a lotion, ointment, cream, powder, foam, spray, or transdermal patch. See the video skill applying an estrogen patch or nitroglycerin ointment. Before applying one, check the medication administration record, or MAR, against the provider's order twice. After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers.
Hi, ma'am. My name's John. I'm going to be your nurse today. Can I ask you your name and your date of birth?
Michelle McBride, 7/30/70.
Ask if she has any allergies.
Do you have any allergies that I need to be aware of?
No.
Then do your 3rd check of the MAR at the bedside. Also, check the expiration date of the medication. As you proceed, keep in mind the 6 rights of medication administration. For a quick review, see the video skill ensuring the 6 rights of medication administration. Apply clean gloves. If the patient's skin is not intact, it may be necessary to use sterile gloves. To use a topical cream, ointment, or oil-based lotion, expose the affected area. Keep unaffected areas covered. Clean and dry the area. If your patient's skin is excessively flaky and dry, apply the topical agent while her skin is still damp. After changing your gloves, place the required amount of medication in the palm of your hand and warm it by briskly rubbing your gloved hands together. Spread the medication evenly over her skin, using long strokes in the direction of hair growth. Avoid rubbing the skin vigorously. Follow the product manufacturer's instructions to determine how thick the layer of medication should be, and mention that her skin may feel a bit greasy for a while. To apply a transdermal patch, such as a nicotine or analgesic patch, apply clean gloves and remove the old patch. Check between the patient's skin folds, if necessary, to find it. Fold the sticky sides together and dispose of the patch according to agency policy. Some agencies require that the patch be cut in half before disposal. Use a felt tip marker to note the date, time, and your initials on the new patch. Apply clean gloves. Apply the new patch to a clean, dry area and avoid using the previous site for at least a week. The site should be relatively free of hair. Avoid skin that's oily, burned, cut, or irritated. When you've found a good site, carefully pull the liner off the new patch. Hold it around the edges without touching the adhesive. Apply the patch immediately to the selected site, pressing it firmly with your hand for 10 seconds. Make sure it adheres well, especially around the edges. Remove your gloves and perform hand hygiene. When you give discharge instructions, explain precautions to take when using the patch. Tell him not to cut it if he's ready for a lower dose. Explain that doing so will disturb the drug delivery mechanism, making the dose unpredictable. Tell him not to use a heating pad on or near the patch, not to reuse an application site for at least a week, and not to combine the patch with other forms of the same drug.
Okay, ma'am, I'm going to put some anesthetic spray on your sunburn. I'm going to ask you to turn your head to the left, and I'm going to give...
To apply an aerosol spray, such as a local anesthetic, have her turn her face away or cover it with a towel. Vigorously shake the container. The label will tell you how far away to hold the container from the application site. but it's usually 6 to 12 inches. That's about 15 to 30 centimeters. Then spray the medication evenly over the affected area.
Hi, ma'am. I have some medication to apply to the irritated areas on your leg today.
Okay.
To apply a suspension-based lotion, put on clean gloves and begin by shaking the container vigorously. Place a small amount of lotion on a gauze dressing or pad and apply it to her skin.
This might feel a little cool when I apply it to your leg.
Dabbing gently over the affected area. Explain to her that the lotion will make the area feel cool and dry.
And it might take a little while for it to dry. Okay.
Oh, okay, thank you.
Avoid rubbing vigorously. Doing so may damage her skin. To apply a powdered medication, the skin surface must be thoroughly dry. With your non-dominant hand, spread any folds of skin, such as between the toes and under the axilla, and dry those areas with a towel. If you're applying the powder near his face, ask him to turn away for a moment. When applying powder near the nose or mouth, sprinkling some into your gloved hand and then applying it to the patient's skin will prevent inhalation. The application site should be covered with a fine, thin layer of powder. Cover the skin with a dressing if ordered by the healthcare provider. As part of your follow-up care, document that the medication was given, including the site of application. Ensure that the patient understands how to properly apply the medication.